The topic of this presentation is how we can follow an online approach to humanitarian collaboration. So, as already discussed, COVID-19 changed society in a fundamental way. First of all, people familiarize themselves with a new reality that they have to help to stop the pandemic from spreading. And also we have to adapt to a new way of life where a lot of activities took place virtually. For the first time, medical communities collaborated on a global scale basis and at a precedented scale. So we worked all together to try to contain the pandemic. So, as the motto says, what does not kill us make us stronger. So I think that even we had a lot of, and we still have a lot of loss of life due to COVID-19, we are better prepared to handle such pandemic crisis. So people familiarize themselves with new online technologies. Technology is here. Online tools are readily available. During to the web revolution during the previous decade and the social media revolution most recently. So our IMIHO website has already embraced the aforementioned technologies, and we have implemented systems that take advantage of these capabilities, which can deliver results at minimal costs. We are operating without a budget. And the idea is that technology removes obstacles. And obstacles were COVID in the past, but right now are other factors, such as the ongoing situation in Ukraine and other places. So what technology can do for you is to remove obstacles. We facilitate collaboration. What obstacles do we remove? First of all, we remove the dimension of space. We have activities taking place virtually. No travel is required. This was very important during COVID when we had limitations of travel. We don't have any borders, and we can bring people together and closer, metaphorically, but we do. And also we have a global reach. We are here people from many nations. Second dimension is time. We can have either synchronous, speak in VTC, or via phone, virtually of course, or chat functions, or we can communicate asynchronously, like email or chat is another example. Also, we can have spontaneous meetings. We don't need to plan in advance. And also we can find information easily. As they say, time is a commodity. Sometimes you measure, but what time you have spent or what time you have saved. So if you do things faster, you save time. Third parameter is the threats factors. We don't have COVID in virtual space. Of course, we have computer viruses, but this is another topic that I will not elaborate on this right now. We don't have any physical dangers, and also keep this in mind because I will mention in the upcoming slides, we have the capability for anonymity. Sometimes anonymity is a bad thing, sometimes it's a good thing, as I will explain later. Then we go to money. A prohibiting factor for a lot of activities is, of course, money, financial limitations. We operate at minimal funding, we use open source solutions, and we emphasize economy rather than spending. We do much more with much less. The fifth element is effort. It's easy to access information. It's easy to perform access functions virtually. It's very easy to facilitate communication. Last, but certainly not least, this is an element that it's left for last, just to emphasize it, is the social element. Technology is not about technology itself. It's about bringing people together. Because people do things. Technology helps people do things. So we have the tools to build a community, to bring people together, to facilitate communication, and of course, the anonymity factor that I mentioned. So we are using these technologies in our website, and we are using right now. This is an example of what and how a tangible result of what we are doing. So IMIHO has established relevant sub-projects that have already been authorized by the SEDEM ministers. This is important because a very important factor is that you have to get authorization to perform activities, especially in a multinational environment. We have done this for you. We have a lot of documents signed by the ministers of the SEDEM nations that they agree, and they actually say this is a good thing to collaborate together. These are projects that I will present have been created in advance of this crisis. However, they can very easily adapt it to facilitate humanitarian efforts, either in the near future or even later. Activities that can be executed virtually according to the instructions and guidance provided by SEDEM at high level, of course. So one activity that is relevant is our military medical archive, that it is a repository of knowledge regarding peacekeeping missions, rescue operations, humanitarian efforts, even war. Of course, we hold not classified information, and it is mostly strictly to healthcare activities. However, it can serve as an information repository for future humanitarian missions in Ukraine or other areas. If we know what we did, how we did it, and what was the results, what was the problems, and what were the lessons learned, we can certainly produce much better result and be much better prepared to provide our services. So this is an initial implementation. The first two presentations we had today, we will put them in the repository so you can access them, and hopefully we will have more presentations and more facts and information later. The next are the online military medical services. So we have established a sub-portal hosted in our website that will provide secure and user-friendly access to online functions, allowing remote execution of telemedicine activities. It is a unique opportunity to provide a multinational platform that can be utilized as a test bed, a place to experiment, to say in simpler words, and work together in these elaborate telemedicine issues that, due to the technologies, are much easier to do. So this is a first demonstration of our ongoing effort. This is something very new. Our online military medical services portal for training. Thank you. Participated in missions, their spouses, which are alone in their houses, and perhaps they are afraid because the husband or the wife is in an area where, we have to be honest, it's not safe. And Marina showed us photos where people were injured due to improvised explosive devices, terrorist attacks, even war. So there is a lot of stress to the personnel and their families. So one way we can help is by providing psychological counseling. How we can do this? People can visit our portal and arrange a meeting anonymously. Some people sometimes are shy or do not want to show their faces. This is not a problem. We are here to speak. We are here to help them, either if we see them with their consent or we do not. And also, we will have some experts who will help and provide some sessions that will try to help relieve the stress, provide support, and just give some advice how to handle stress or depression or fear. All this could take place in virtual room where we can validate anonymously, but with some elementary controls, the execution of such sessions. Cameras can be open or closed as the people who ask helps wishes. So these are the proposed services. This is something, of course, ongoing. And to close this presentation, we can provide these services. However, we need two things. The first thing is the SEDEM authorization, which we have in some cases, such as the services. The second is the provision of experts by the nations. We provide the tools to do it. However, it's up to the nations to dedicate resources and take advantage of these technologies, either at international or even with a national focus. However, I would emphasize the international aspect of this initiative, which would be really useful for economy, research, and other factors. So